so much for being here. So today we have Dr. Alex Wong. So Dr. Alex Wong is the professor of Department of Surgery. He's the chief of the Division of Plastic Surgery, interim chief, Division of Dermatology for City of Hope National Medical Center and the Beckman Research Institute. So Dr. Wong is also the adjunct clinical professor of surgery for the Division of Plastic and Reconstructive Surgery of Keck School of Medicine of USC. And he's also a dear advisor for Wound Reference. So thank you so much for being here with us today, Dr. Wong.
My pleasure.
Fantastic. So we're going to be talking today about lymphedema and radiation-induced cutaneous damage and soft tissue radiant necrosis. So we have prepared a series of questions here. Would that be okay, Dr. Wong, for us to kind of get started with some lymphedema questions?
For sure.
Wonderful. All right. So would you please start out by elaborating a little bit on the role of the different specialties in lymphedema management, and also maybe how care should be coordinated for best outcomes?
Sure. Thanks, Dr. Song. That's a great question. Lymphedema, as you know, is a really challenging disease process that affects millions of individuals. And we're getting better and better at taking care of this disease in these patients, and yet there's still opportunities to do better. In my institution and my previous experience, I've found that a multidisciplinary approach to treating these difficult patients leads to best outcomes. And this includes a conversation between really the first line people, the lymphedema therapists, who often are housed in the departments of occupational therapy, as well as medical physicians that manage lymphedema patients that may have comorbid conditions, basic and translational researchers that can advise us on cutting edge therapies for lymphedema, as well as surgeons and microsurgeons that are expert in offering surgical treatments for lymphedema. And so it's really this interaction of the whole team that allows for best practices. And I'm happy to have been involved in this when I was at USC. And now that I've moved to City of Hope, we have a similar construct to do this. And so frequent communication is key, just like for all sorts of other complex diseases, so that there's a good conversation to provide best care and individualized care for every patient that comes through the door.
Wow, fantastic. It's a really, truly comprehensive system that's needed in order to treat lymphedema patients. And then so amazing that you have the Center of Excellence that you set up at both at USC and City of Hope. That's really impressive.